Dear colleagues, ladies and gentlemen, my name is Alfred Tam from Hong Kong. I'm happy to moderate this satellite symposia entitled Pediatric Pulmonary Diseases in Asia. The next lecture is going to be delivered by Professor Dr. Yang Hyun-jong from Korea. His topic is going to be Pediatric Pulmonary Diseases Experience in Korea. Please welcome Professor Yang.
Thanks for giving opportunity to present this talk, Pediatric Pulmonary Disease Experiences in Korea. I'm Hyun-jong Yang, Suncheon University, Seoul Hospital, Korea. I'm a member of PRED study group of CAPAD. I will talk today on the behalf of PRED. I will introduce our study group. PRED is Pneumonia and Respiratory Disease Study Group of CAPAD. Pneumonia and pediatric lung disease are interesting to study. I will introduce Korean experiences in post, retrospective and prospective nationwide surveillance of Mycoplasma pneumonia. During 2010 to 2015, 23 medical centers collected dataset, hospitalized pneumonia children. We collected total of 65,000 pediatric pneumonia. Among them, 5,000 were Mycoplasma pneumonia, MPP. MPP epidemics in South Korea every 3 and 4 years interval. We found clinical diagnosed macrolide refractory pneumonia increasing trend. MRMP shows more hospital stay and fever duration and more severe respiratory symptoms, respiratory distress, cyanosis, oxygen demand, ICU admission, compared with macrolide sensitive pneumonia. Also, MRMP shows more lobar consolidation and atelectasis pleural effusion than compared with MSMP. Extrapulmonary manifestation also, MRMP shows more higher liver enzyme elevations, proteinuria, skin and mucosa involvement, arthritis. To overcome these limitations, we start prospective surveillance from 2018. We collected symptoms from 500 pneumonia children. Among them, 98 were MPP. After sequence analysis of 23S rRNA gene, 55% were mutation. All mutations were A2063G. In these small samples, we compared clinical findings. MRMP shows more fever duration and length of hospital stay. Previous many papers reported CRP or LDH may only predict of MRMP. Thus, we performed replication of these two biomarkers. In prospective setting, CRP and LDH higher in mutation group. It also replicated in the retrospective dataset, but the performance is not excellent. In 2019, we developed clinical practice guideline for severe macrolide refractory Mycoplasma pneumonia. In this summary figure, after 3 days, macrolide treatment, if fever persists or disease progress, if is severe form of pneumonia. This guideline recommend corticosteroid and alternate antibiotics step by step or at the same time. You can download this guideline in this link. Recently, interesting results were reported from Japan. Antibiotic stewardship may reduce MRNP prevalence. In this report, MRNP had decreased from 75 to 50% at 2015, and only antibiotic stewardship has changed. They highlighted that antibiotics stewardship may reduce the prevalence of MRNP. Whether it's unfortunate or fortunate, COVID-19 did not allow the expected epidemics of MRNP during the 19 and 2020 in South Korea. Anyway, we continuously do our best to collect samples and data. And we wait the next epidemics and try to plan for the research trail. Like as the nationwide alarming monitoring network, at the MRNP personal level, we had decided to link clinical genetics and national claims data and trying to prepare global research network and various R&D project. In this slide, I will show bronchiectasis in Korea. The bronchiectasis in South Korea were lately diagnosed. The mean age at the diagnosis approximately 9 years old. Most common findings are chronic cough, recurrent pneumonia, recurrent fever, and dyspnea. Bronchoscope performed only 26% of patients, and sweat test or genetic test only 3%. Most common cause are infections, including tuberculosis, PIBO, and secondary primary ciliary dyskinesia, immune deficiency, and aspiration syndrome. Cystic fibrosis are rare in South Korea, just 5 patients. We found more lung involvement associated with poor lung function. Thus, we need early diagnosis and appropriate treatment of bronchiectasis to improve lung function and prevent infections. But we have no available weapon to manage bronchiectasis. Thus, we need effort to develop a new drug and devices. In 2020, we developed a clinical practice guideline for pediatric bronchiectasis. In this summary figure, the guideline recommends long-term macrolide treatment and hypertonic saline inhalation in severe pediatric bronchiectasis to improve lung function and prevent infection. Lastly, I will introduce PCD registry in Korea. Total 31 clinically relevant PCD cases registered. Among them, 90 patients confirmed by genetic test and 14 patients confirmed by EM findings. Just 6 patients were situs inversus. This slide shows typical phenotype of PCD in South Korea. Early onset of respiratory symptoms and bronchiectasis, sometimes situs inversus. This slide is last one. Take-home message. We started prospective data integration project funded by KCDC, healthcare claim data integration with registry data. In second, nationwide PCD registry, we also expanded to integration with healthcare big data. In third, we launched CIS fibrosis registry on 2021. Take it together in the near future, we hope for global collaboration, and we are planning to expand our work to pediatric orphan lung disease. Thank you for your attention.